ERA's Lucknow Medical College, a constituent college of ERA University, is an L3 COVID facility which has treated more than 3,200 patients with moderate to severe COVID-19, with an extraordinary recovery rate of 94.2%. This has been possible due to ERA's comprehensive COVID care approach, which is comprised of the hard work of our dedicated healthcare workers, our focus on personalized nutrition and anti-cytokine storm supplementation, chest physiotherapy and positioning for airway clearance, counseling and stress management sessions for patients, and the use of innovative equipments and digital tools for proactive patient management. All of these have collectively resulted in the tremendous recovery rate of COVID-19 patients at ERA. As of 20th February 2021, ERA's comprehensive COVID care approach has resulted in a recovery rate of 94.2%, which is the highest recovery rate of an L3 COVID facility in UP and among the best in India. This means that the recovery rate of the L3 patients admitted at ERA is nearly as good as the global COVID-19 recovery rate of 97.2%, which includes not just L3 but also L2, L1 and home isolation patients. This is not an ideal comparison since majority of COVID-19 cases that make up this high recovery rate are home isolated patients who recover without requiring any hospitalization, whereas at ERA we have treated L3 patients for whom COVID-19 is most severe. And yet, the recovery rate of such seriously ill patients at ERA has not been far from the recovery rate of milder COVID-19 patients. A more appropriate analysis would be to compare the COVID-19 ICU recovery rate at ERA with other ICUs across the world. 84% of patients admitted at ERA's COVID-19 ICU recovered. In comparison, one study reported the following global recovery rates in COVID-19 ICUs: 56% in China, 30% in USA, 52% in UK, and 44% in Germany. More recently, recovery rate at COVID-19 ICUs around the world has been estimated to be 60%. Analysis of the COVID-19 deaths at ERA reveals that almost all of those patients had progressed to a critical condition before being hospitalized. Out of the 186 deceased patients, 177 were directly admitted into the ICU. 3 required critical care within 24 hours from the time of admission, and only 6 COVID-19 patients that were not in a critical condition for the first 24 hours died. This means that 96.8% of deceased patients were critical either at the time of admission or within 24 hours of being admitted. Only 3.2% of deceased patients remained non-critical for the first 24 hours. This also means that only 0.2% of patients that were admitted in our hospital in a timely manner died. Moreover, by God's grace, our comprehensive care approach has helped maintain a 100% recovery rate amongst 180 plus staff members that have had COVID-19 so far. As they received ERA's comprehensive COVID care in a timely manner, all of them recovered with nearly no complications or oxygen requirement. The 99.79% recovery rate amongst timely admitted patients and the 100% recovery rate amongst our staff members suggests that a very high recovery rate amongst COVID-19 patients is achievable if they receive comprehensive care similar to that provided at ERA in a timely manner. We applaud all members of ERA family for the multidisciplinary efforts that have brought about such remarkable results.